morning, Mr. Smith. My name is Jessica. I'm going to be your nurse today. Can you confirm your name and date of birth for me? And do you have any allergies? What about to corn or corn products? Okay, thank you. I'm going to do hand hygiene. All right. I would also make sure that I assess the patient's renal function. I would assess his IV site. His IV site looks good. It's not red, no pallor, no swelling, no pain. I also want to make sure that the solution of the clarity of my vancomycin is clear, and it is. It looks normal. I'm going to educate the patient a little bit about vancomycin and its side effects. Mr. Smith, vancomycin is an antibiotic. It's going to help treat your infection. If you start to notice that you feel like you are having a rash, or you feel like you are flushed, like your heart is beating fast, or if you have hearing loss or anything like that, urinary issues, I want you to let me know. And if your IV site starts to feel like it's painful or red or swelling, let me know. Okay, I'm going to get ready with my setup. I'm going to confirm with the MAR that I have vancomycin. I'm going to make sure I have the right dose, the time, the route, the patient, the right med, and the right documentation. So this is vancomycin. And my rate of administration per IV pump would be 2.5 milliliters. And that is going to be ran slowly over 60 minutes. And my drop factor would be 38 drops per minute. Okay. Vanc does have compatibility issues. It has a very low pH, and so mixed with a lot of other drugs, you can have complications in its effectiveness, and it might even precipitate something. So I want to go ahead and get my gloves on, and I will start to hang my vancomycin. Okay. Get this up here. Get my tubing out and ready. My clamp is going to be turned off. I'm going to spike my bag. Okay, now I'm going to hang my vancomycin. And I want to make sure that I have an alcohol prep pad, which is going to be a thing. Okay, so now I'm going to flush my tubing, make sure that there's no air bubbles and that I get all of the med get all my air bubbles out. One more air bubble. Okay, great. So now I'm going to use this antiseptic pad, and I'm going to clean my Y site. I'll let that dry. Now I'm going to connect my vancomycin to my Y site. I'm going to lower my bag of normal saline, and I'm going to open my clamp and ensure that the pump is set to the right milliliter per hour, which was 2.5. All right, and everything looks good. My patient is comfortable. I'll make sure he doesn't have any more questions for me, and I will be back to check on him.